of labs, you usually think about taking blood tests for medical reasons. In my case, it was business related because it was part of a job requirement. One of the tests that they did was a test for syphilis. And when the results came back, I was told that I was tested positive for syphilis. Imagine at 21 being given that diagnosis. Whilst I was there, another technician came in and said that they needed to take fresh samples because there was a mix-up and there was a possibility that the results were wrong. The second test all came back negative and I was given the all clear. But think about the devastation that left me feeling.
The doctors need these results in order to treat us for whatever it is we are suffering from. And if they get a wrong result, then they would treat us, according to the result that they would have in front of them.
As an immunologist, concerned with the body's own natural defenses, your body has an amazing capacity to heal. But people are getting sicker and sicker as we go along. And it's important that we understand what's making people sick so that we can have the proper interventions. And that's where laboratories make a huge difference, because laboratories provide the actual evidence for what's happening in the person's body.
In talking to the young doctors in particular, who are now the people that we are entrusting with our patients in the health centers and other places and in private offices like that, they were horrified to find out that most of the labs in Trinidad are not accredited. And they had placed so much trust in these labs. And it was very disappointing for them to find out that in the public sector and in the private sector in Trinidad, majority of labs are not accredited.
Results from one lab that is not standardized differs from the standardized lab. So the non-standardized lab may tell a patient that they are positive for a certain disease, whereas when it goes to the standardized lab, they are not. And there lies the need for standardizing labs across the Caribbean.
Yes, CMLF came into being somewhere in 2008, and part of our actually remit was as a consequence of the HIV epidemic, and to bring labs to the table to see what's our role and how are we going to make a difference and an impact on the way in which the region is going to manage this particular epidemic.
We, as the regional champion for best practice in laboratory services, are really about you getting the best possible result and an accurate result every time you visit a lab for informing you about your healthcare. And we work with governments, we work with regulatory bodies, we work with communities, we work with people, and of course the labs and accreditation bodies to ensure that the lab results that each and every one of us actually receives is a quality result, an accurate result that can really contribute to our personal health care. Caribbean MedLabs Foundation. Your health, our passion. Quality matters.